With a short introduction.
Absolutely. My name is Katelyn Harms, and I'm the Infection Prevention Program Manager here at UnityPoint Health Meritor.
And I'm Stephani. I'm the ER Manager here at UnityPoint Health Meritor.
Could you provide a description of RSV and explain how it differs from other respiratory illnesses?
Absolutely. So RSV stands for the Respiratory Syncytial Virus. It's a common respiratory illness that's usually spread in our area during respiratory illness season, which is usually defined as the cold months around here. It can present as the common cold in a lot of people, so your sniffles, your low fever, your aches. Anyone can be affected with RSV. However, in our most vulnerable populations, like our infants and our immunocompromised adult population, is when RSV can be really severe, and those are the populations that we're most worried about.
How did this year's RSV positive test numbers compare to past years?
So RSV season has been much more significant this year. In an average year, RSV usually starts at the end of December, peaks around late January, early February, and tapers off from there. What we're seeing this year is that spike began in October. So in Wisconsin, for the past 2 weeks, Wisconsin has reported over 2,000 positive RSV cases, which is significantly higher than we've seen before. And it's also been very notable in that past 2 years, we've been in the middle of our COVID-19 pandemic, and other respiratory illnesses were really absent. We did not see a significant flu season, we did not see a significant RSV season, and all of that is likely related to the public health mitigation strategies that were in place for the COVID-19 pandemic. So that staying at home, wearing masks, avoiding crowds, all of that contributed to fewer other respiratory illnesses. And since we've backed off on a lot of those public health precautions, it's a likely reason we're seeing a greater number this year.
What are the symptoms of RSV?
Like Katelyn mentioned, it can blend in with other respiratory illnesses, so cough, fever, congestion, runny nose.
How soon after symptom onset should you seek medical care?
It depends. Anytime you see severe symptoms, you should seek medical care, but any prolonged mild symptoms should be taken care of as well with a doctor visit. So fever for more than 3 days, anytime you have drainage coming from eyes or ears, anytime the child, if for a child decreased intake is a time to call your primary doc.
Can RSV be treated at home?
You can treat at home, especially for mild symptoms. We like to call them supportive symptoms or supportive measures in the ER. So lots of fluids, lots of rest. For children over 2 months, Tylenol. Children over 6 months, ibuprofen. Those can all be treated. Contact your provider though anytime you have questions about those kinds of things. And cool mist vaporizers are also highly recommended in a lot of scenarios.
Are antibiotics a treatment?
Antibiotics are not a treatment for this. It's a virus, so it's antibiotics have no impact.
When should a sick person seek emergency medical care?
Severe symptoms of difficulty breathing, if there's rough breathing sounds, if for a small child, if when they breathe you can see their ribs kind of sticking out, if there is a fever of over 104, or anytime there's a fever in a child that's under 12 months, that's a time to see them, to seek treatment right away. Lethargic children, if they're just kind of blah, laying there, and dehydration, where decreased urine output, really dark urine, dry mouth, crying with no tears, those are signs and symptoms you should seek medical care in the ER.
Who's at the greatest risk for severe illness?
I can take that one too. So RSV is most severe in young infants, so less than 12 months of age, or older adults, populations that have other chronic illnesses or other immunocompromising factors. In that infant population, those kids with RSV will always show symptoms. And it's those, as Andy mentioned, those examples of shallow, rapid breathing, cough, are what we're really worried about.
How can I prevent RSV infection?
This is right up Katelyn's wheelhouse.
It's my favorite question. So RSV can be prevented by avoiding sick people. So keeping those sick kiddos out of daycare and out of school to prevent exposure to other kids is really, really important. So staying home when you're ill. Same for adults, even with those mild symptoms, staying home when you're ill and avoiding exposure to other people. Luckily, our other respiratory illness strategies still apply here too. So masking is always an option when you're in crowded spaces. Avoid touching your face, wash your hands frequently. And I'll also put in a plug for our regular vaccinations. So even your influenza vaccination and your COVID vaccination or your bivalent booster will help in reducing the overall burden of respiratory illnesses.
Okay, thank you so much for being here. You want to sign off?
Absolutely. Thanks for
Thank you.
listening.